loss of vision in malignant hypertension. Definitions. Malignant hypertension can affect organs such as the retina. The retina is a layer of tissue in the back of the eye that transforms light and the image that enter the eye in nerve signals that are sent to the brain. When the blood pressure increases, it can damage the blood vessels in the retina due to the obstruction of the arteries and veins.
High blood pressure can affect the eyes in multiple different ways. So most commonly, people who have long-term chronic high blood pressure, they develop slow changes where the blood vessels start getting thinner, they start to harden, and then the blood doesn't get to the tissue quite as well. The retina won't work as well. It can cause something called retinal vein occlusion, whereby basically you have a stroke inside the eye that can cause a hemorrhage and vision loss. And then also acutely, if you have a sudden spike in blood pressure for some reason, that can cause swelling of the optic nerve, and that can also cause decreased vision. And in the eye, when we can find these changes, then that is highly suggestive to us that there's changes elsewhere in the body, and that a really thorough exam and coordination with the primary medical care doctor needs to be done.
Applications in medicine. The reversible loss of vision in malignant hypertension has helped us in medicine to discover new tests to be able to detect it in time, as it is a software that analyzes images of the retina to detect diseases. It values the information provided by background photographs of eyes, through which the blood vessels can be visualized in detail, which in turn provide relevant data on the health status of the patient, as well as having a capacity for analysis closer to the diagnosis. People can take prevention measures such as eat healthy. Pros and cons. Pros. The vision is not lost completely with a diagnosis and treatment in time. This pathology can be reversible.
Did you know that high blood pressure can cause a stroke to your eye? In recent studies, approximately 20% of people have high blood pressure. 20% of people have high blood pressure, and we can see changes a lot sooner in the back of the eye. That's why it's important for us to have a dilated eye exam for us to assess the back of a person's eye. High blood pressure affects the eye by causing the retinal blood vessels to become narrow, thus not allowing proper blood flow to our eye. Due to this disruptive blood flow, a mini stroke may develop in our eye. The only treatment for hypertensive changes in the back of the eye is to have a well-controlled blood pressure. Due to the significant amount of patients living in Canada with high blood pressure, we will co-manage this disease with their primary care physician.
Cons. The high pressure can damage the blood vessels, affecting the retina. These conditions can lead to problems in vision, so this will depend of the individual. If this is a diabetic and has high blood pressure, the risk is higher. Issue apply in Ecuador. Currently in Ecuador there is an increase in the population with hypertension due to the pace of life that is currently lived. Since it is very fast and busy, the factors that increase this risk are stress, nutrition, and lack of commitment to perform physical exercises that at the country level can be evidenced. For this reason, there have been more cases of hypertensive retinopathy.
Hypertension also causes retinal problems. It can cause hypertensive retinopathy. In hypertensive retinopathies, even patient may get vessel blocks like branch retinal vein occlusion or central vein occlusion or central retinal artery occlusion can get affected, which may cause blindness also. Hypertensive patients also periodical eye examination is necessary.
Conclusion. Hypertension is a problem that expands if not treated in time, because it can lead to several parts of the body, such as the retina. You have to know that you can get to die if there is a proper functioning in the recovery process. So it is better to take all prevention measures and avoid irreversible health problems.